Welcome to the Palliative Care Information to Support Practice Educational Program, Palliative Care Communication for Nurses. The goal of this program is to improve care delivery through addressing the essential role nurses and other clinicians have in communicating information about palliative care to persons in their care. In this way, improving early and timely access to palliative care services. Welcome to the Palliative Care Information to Support Practice Educational Program. Welcome. This is Module 1 in the series, Palliative Care Communication for Nurses, Knowledge, Skills, and Attitudes. This module sets the foundation for the information that will be presented in Modules 2 through 7. The modules following this one provide content to explore other aspects of these modules as they relate to palliative care communication, as well as additional information and suggestions for application in nursing practice. Welcome to Module 1, Dying in America, Overview of the Institute of Medicine Report. Each educational module in this program will be delivered in a similar format. First, you will be introduced to the topic. Next, you will be asked to take a pre-test, complete the educational module, and finally, complete the post-test. Please complete the pre-test at this time by following this link. In September of 2014, the Institute of Medicine released an important report on end-of-life care and care among those experiencing serious life-limiting illness. The report, entitled Dying in America, Improving Quality and Honoring Individual Preferences Near the End of Life, was the report of an expert panel convened to discuss these issues. The Institute of Medicine, in publishing this report, believes that quality end-of-life care should be a national priority. While progress has been made at improving care at the end of life, there are still many opportunities for improvement, and more specifically among healthcare providers in engaging at the level of a person and family-centered care practice as a way of honoring individual preferences. This report is a comprehensive assessment of dying in America and highlights the needs agreed on by the expert panel to be most pressing. The full report may be downloaded for free and accessed in the resources that accompany this presentation. Let us begin by understanding some of the key findings and recommendations of this report. The report highlights 5 main key findings and supports these key findings with recommendations. These domains are complex and interlinked. They include 1. Delivery of person-centered and family-oriented care. 2. Clinician-patient-centered communication and advanced care planning. 3. Professional education and development. 4. Policies and payment systems. And 5. Public engagement and education. An improvement in one area, for example, policies and payment systems, has the potential to make greater progress in other areas such as professional education and delivery of person-centered care. Public education and engagement, the demand for improved end-of-life care, can elevate expectations and influence healthcare delivery. In our role as nurses and healthcare providers, we can be aware of our own actions, knowledge, skills, and attitudes in addressing these recommendations and understand within the systems and communities we work and live where the challenges are and begin to achieve changes in practice to improve quality care delivery. This report serves as a framework. These are the recommendations in which to improve palliative care and quality end-of-life care. Let us begin by looking at the first domain and recommendation for the improvement of end-of-life care. Delivery of person-centered and family-oriented care. Person-centered care and family, friends, and caregivers being engaged in care is vital, yet still many systems of care are challenged in being person-centered. It is important to clearly ask and reflect on our practice and ask, is it person-centered? Are the decisions being led and agreed upon by the person and shared with the healthcare team? Engaging the person at the center of their care defines the relationship as important to the ultimate goals of the person. This often means care is delivered in a holistic way, addressing the physical as well as the mental and spiritual dimensions of care, and being conscious of the environment in which care is delivered and how it meets the person's needs. While access to palliative care is improving, it continues to often be delivered very late in the course of serious and life-limiting illness. Early access to palliative care has been found to improve comfort, quality, and in many cases extend life, and is also an important component for long-term progressive conditions. There does remain a disparity in who and where palliative care can be accessed and delivered. Although well established in most large hospitals, the Institute of Medicine report identifies the need for a greater understanding of the role of palliative care by the public and healthcare professionals as one of the greatest challenges in meeting this goal to deliver high-quality care. Recommendation 2. Clinician-patient communication and advanced care planning. Advanced care planning includes selection of a healthcare proxy and clear decision-making to guide the healthcare proxy in areas such as life-supportive treatment, such as CPR, ventilation, and artificial feeding decisions. Advanced care planning and proxy selection is key to be able to communicate one's preferences when physical or mental compromise make it necessary for a designated person, a proxy, to ensure patient goals are met at the end of life. Advanced care planning, however, does not take the place of open, compassionate, and continuous communication about care preferences, prognosis, and palliative care options. Quality standards for communication are essential. What is quality communication and how is that delivered, assessed, and evaluated within healthcare settings and among providers? Communication as a key area of the nursing profession will be the focus of the modules precisely in the beginning to address this key area of quality improvement. Domain 3, Professional Education and Development. While knowledge is one important step, it is also clear that knowledge alone does not change behavior, nor is easily translated into care practices. This is partly to do with systems-level changes that are also needed. Other reasons that palliative care is not more widely accessible is that there are few specialists in palliative care. And palliative care knowledge needs to be provided to all clinicians in order for all members of the healthcare team to be proficient in palliative care and end-of-life care. While the establishment of specialty practices in palliative care is a major improvement in the education of health professionals, problems still remain as challenges in need of improvement. And these include attention to palliative care in nursing and medical school curricula, equipping physicians and nurses with communication skills, and improving interprofessional teams that are necessary for providing this level of quality care. Domain 4, Recommendations for Policies and Payment Systems. Reform is needed in how resources are provided and organized near the end of life. In returning to the first recommendation on access to person and family-centered care delivery, we return to understanding a care system that continues to be highly organized with its resources around acute care. Part of the reliance on acute care is the availability of it as a dominant paradigm in our health service marketplace and as a delivery system. While advances in acute care have continued to progress, care of chronic and terminal conditions is often not well supported by those same resources and interventions. There is a need to address on the policy and payment levels other systems of integrated care, improved community and home-based care options, and systems that encourage relationships over time between persons in need of care and those professionals that deliver it. Reorienting payment systems to incentivize and integrate care, the coordination of care, advanced care planning, and shared decision-making that align services with patient goals and preferences is recommended. The fifth domain and recommendation is public education and engagement. While individuals' values and beliefs about end-of-life care will differ, it is essential to emphasize the importance of this area of health and care through engaging the public in demanding improved care, access to advanced care planning, and increasing the public's expectations that compassionate, affordable, and quality care is achievable. The remainder of these modules will focus on palliative care and communicating about palliative care, with nurses as leaders. Palliative care promotes the reduction of suffering and is focused on palliating or to make the effects of something such as an illness less painful or harmful. Relieving or soothing the symptoms of a disease or a disorder without necessarily effecting a cure. Therefore, palliative care is largely focused on managing symptoms and addressing body, mind, and spirit and personal goals. In meeting these goals, palliative care is delivered through a team approach with access to spiritual care, care coordination, and symptom management. This ends the Educational Module 1, Dying in America, Overview of the Institute of Medicine Report, which serves as a framework for the quality improvement initiatives and recommendations for improving end-of-life and palliative care. Thank you for your participation. Please proceed to the link below in order to complete the post-test. And again, thank you for participating in the Palliative Care Information to Support Practice Educational Program, Palliative Care Communication for Nurses, Knowledge, Skills, and Attitude. Listed here are two important references that have supported this module that has primarily been focused on the Institute of Medicine's Dying in America 2014 report, Improving Quality and Honoring Individual Preferences Near the End of Life, available from the National Academies Press, as well as the website here will link to many other important references and resources to support your ongoing learning. Thank you again for your participation.